Okay, I am ready.
Okay, so if you have read and understood, considering 8 history taking station, please begin.
Hello, I am Dr. Ahmed Awad, one of the surgical doctor. Can I confirm your name and age, please?
Yes, doctor. I am Robert, 56 years old.
Hello, Mr. Robert. How can I help you today?
Doctor, I have a painful swelling on my neck
Okay, sorry to hear that. Since when this is swelling, Mr. Robert?
since 2 months.
Okay, in which part of your neck this is swelling? In the right or left, up or down?
Is the right side on the right upper side.
Upper side. Okay. Is this swelling increasing within these 2 months? Is this swelling increasing or decreasing?
Is increasing, doctor, is gradually increasing.
Okay. Is it appeared suddenly or gradually or what?
Is gradual, doctor.
Okay. Is there is any change over this is a swelling or discharge from this swelling?
No, there is no discharge.
Is there any fever?
No, doctor.
Okay. Do you notice that something that make it smaller or something that make it bigger?
No, there's nothing like this.
Is this lump you feel it pulsating with your heartbeat?
No, doctor.
Okay. Do you have other lump in your body?
No, there's no other lump.
Okay. Do you have any change in your voice?
No,
Okay. Do you have any change in your swallowing or drinking?
no,
Please,
doctor.
please.
You have?
Oh, yes, yes. I
Okay.
have
For
some
for
discomfort on swallowing. Yeah.
for liquid or for solid food?
It's both, both, but it's
For
mostly
both.
in
Okay.
solid. Yes.
Oh, it's most frustrating for you.
Mhm. Yes,
Okay.
doctor.
Can you tell me if you have any change in your weight?
Yes, I have reduced some weight. I cannot tell you that how much I lose, but I think
Oh,
my dress are becoming looser now.
okay. What's about your appetite?
It's also decreasing.
Okay. Can you tell me if do you have any you have feeling your heartbeat?
No, it seems it's normal. No problem.
Okay. Do you have any problem with your breathing or when you are lying flat, there is any feeling of difficulty to take your breath?
No,
Okay. Can you tell me if you have uh, any change in your or abnormal movement in your hand
no, doctor.
or intolerance to the hot weather or cold weather?
No,
Do you have any change in your skin in your legs or swelling in your legs?
no,
Okay. Can I ask you some question if you have any medical illness?
no,
Do you take any medication?
no,
Do you have any allergy from any drug?
no. Not drug. I
O-
have some dust allergy, but no other.
Okay, do you have any history of surgery before?
No, doctor.
Uh, did you treated before from thyroid disease or disease like this?
No,
Do you have any family history of same condition?
no, no.
Can I ask you some personal question?
Yes, doctor.
Okay, what's your job, Mr. Robert?
I'm a businessman.
Okay, do you smoke?
No,
Do you drink alcohol?
Yeah, occasionally.
Okay. What's your idea about this swelling?
I don't know, doctor. I'm very concerned about this thing. I don't know. Is it a cancer or what is it?
Okay, it's early to say that we need to do some investigation and examination for you. Okay, can you tell me what's your expectation from us?
Yeah, I want you to diagnose what is the problem.
Okay, can you tell me if do you have any cough,
No, doctor.
any sputum,
No,
any foreign travel for a foreign country?
no,
Okay, okay, do you have any vomiting or diarrhea?
no, doctor.
Any weakness in your upper limb or lower limb?
No.
Okay, thank you, Mr. Robert. I will update my consultant and we'll see you again.
Okay, doctor.
Okay. Can you please summarize your history
Okay.
now?
Today I have to present Mr. Robert. He is 53 years old, male patient, medical free, complaining of right upper neck swelling
Yes.
since 2 months, progressive in course, gradual onset. There is no the swelling is not pulsating. There
Yes.
is a change in his voice and difficulty in swallowing. There is no fever, no associate. No, there is a weight loss about. He cannot exactly give me the how much he lost of weight, but he lost of weight in the last 2 months and decrease in his appetite. No fever, no other symptoms.
Okay. So after considering the stem, what is your provisional and differential diagnosis?
The top differential diagnosis is squamous cell carcinoma.
Yes.
The other is thyroid tumor or tonsillar abscess or tonsillar abscess or thyroid swelling or lymph node enlargement.
Okay. Right. How would you confirm your diagnosis?
To confirm the diagnosis, he need a full examination, head and neck,
Yes.
and then he need maybe CT scan and or MRI for his head and neck,
Okay.
and may he need a biopsy from
Okay.
the swelling.
Right. What treatment can you suggest this gentleman?
For he need surgery with the lymph node dissection, excision with lymph node dissection.
Your first diagnosis was squamous cell carcinoma. So after you have received the labs, you will discuss it with multidisciplinary
Yeah.
team, and then you will decide, right?
Yeah.
So this is the first, and then you will decide if he needs radiotherapy or depending upon the labs or excision biopsy.
Yes,
Right.
sir.
Your first primary provisional diagnosis was correct. Second and third options were not as correct because see, this is the tonsillar swelling. If it is not because of squamous cell carcinoma, so that could even be lymphoma. See, the close differential diagnosis, or it could be tuberculosis because you are saying lymph nodes enlargement, so that could occur only in tuberculosis.
Yes.
There could even be glandular fever. You said thyroid, but thyroid is outside the neck.
Yeah.
Yes. So those second, third, fourth diagnosis that you gave, differential diagnosis, were incorrect. And if we consider tuberculosis as number 2 or 3, 3 or 4, or among the one of the differential diagnosis, then you, in order to rule that out, you could ask, you did ask fever. So that rules out glandular fever or tuberculosis.
Yeah.
Lymphoma. So you should ask if patient has a complaint of night sweats, like if patient wakes up in the middle of night all sweating or bathed in sweats. So night sweating is one question that
Yes.
could have been added. All the rest is correct. And if you'll consider glandular fever and lymphoma and tuberculosis and etc., then you would have to think of other tests as well, like monospot test for, yes, detecting glandular fever, and for tuberculosis, there's spot test, sputum test, etc.
Yeah.
And yes. All right. Thank you.
Okay.
Good. Right. So that was